So, COVID-19 cases are on the rise again in India, with notable increases in cities like Delhi, Mumbai, Bengaluru, and Gurgaon. In Kerala, recent data shows 273 active cases, with Kottayam and Thiruvananthapuram being the most affected. While these numbers are still manageable, they serve as a timely reminder that the virus hasn't disappeared. As many have returned to pre-pandemic routines, it's crucial to reintroduce simple precautions like mask wearing, hand hygiene, and safe travel practices. Today, we'll discuss how these small steps can make a significant difference in keeping us safe. So today, we are joined by Dr. Sujan Bardhan, a highly respected consultant in pulmonology at Rabindranath Tagore International Institute of Cardiac Sciences, Kolkata, with an MBBS and MD in tuberculosis and chest diseases. Dr. Bardhan brings deep expertise in managing a wide spectrum of respiratory conditions, including asthma, COPD, bronchitis, and infectious lung diseases. Welcome, Dr. Bardhan.
Thank you, Akshay.
So, sir, my first question to you is, as we know that there are 250 plus cases of COVID in India right now. So, COVID cases are rising again. Should people like me be worried? Normal public should be worried or not?
I think to that question, I would say an emphatic no. It's not something to be worried about for patients who are immunocompetent like you. For persons who are immunocompetent and who do not have comorbidities, it is just like any other normal viral flu with a similar type of symptoms. But if you are immunocompromised, if you have severe comorbidities, if you are at the spectrum of age, at the end of the spectrum, so either you are very young or you are very aged, in these patients, you need to take special precautions, especially in patients who are having cancer, who are undergoing some immunosuppressive therapies, and patients who have uncontrolled diabetes. These are the patients who should be a bit cautious about this disease. Otherwise, in most of the cases, it will be just like a simple flu.
So, sir, is this rise in cases connected to a new variant?
Basically, what we would say, it is definitely a new variant of the Omicron, that is JN.1. This is the mostly the subtypes of JN.1 that are causing this one. But the rise in cases, I would say, this is the new normal for India, for not only for India, for the entire world, basically, because and COVID is there to stay. COVID is endemic in our society, and it will come with multiple mutations. Certain mutations will come, and then they will cause this surges on and off. But yes, we have. It has been quite some time that we have got infected, and we have received the vaccinations. That is almost 3 or 4 years that has gone by. So gradually our immune system, our immunity that we had developed against the COVID is gradually waning off. So now these variants, once they come, they can bypass the immune system and cause this sort of surges.
Okay, sir. So, like how we talked about this new variant compared to the earlier strains in terms of how fast it spreads or how sick it makes people.
The new variant, the new variants, they are more infectious, you can say, but they are not. The severity of the disease won't be much. Unlike the Delta variant, which was very severe, the Omicron variant, which was earlier there, that was much less severe. But yes, definitely the mutant strains are more infectious. So the rate or rapidity of spread of the disease will be a bit faster than what we had seen in the earlier cases. But the severity, if we take the severity into account, we are not getting very severe cases.
Okay, sir. So we have seen like most people have gone back to life as usual. They are living normally, no mask, no distancing. From a medical perspective, how risky is that right now?
All medical personnel, we have been saying since long that the COVID norms are there to stay. So it's not like COVID is not going to go away from the society in the very near future. So we have to make it the normal, the distancing, the isolations once you get infected, washing your hands properly, putting on the mask when you go to areas which are congested, where densely populated areas like the malls or the parks or the cinema halls and all. So more so during this surge, I would advise, the only thing that is to be advised is once we go out into the crowded places, we need to wear a mask. We need to avoid overcrowdings. We need to maintain the distances, and especially the hand hygiene. Hand hygiene is extremely important, especially we don't want the to bring the virus to our houses, to our homes, and give it to our elderly people who are there in our household. So we should be a bit cautious about that.
So, what can be the your key message to the public right now, especially to those who believe COVID is completely behind us, like it's no more there?
So what I told you earlier, it's COVID is the new normal for everybody. Nothing to panic about this surges. These surges will come on and off. They will be coming, and we need to be prepared with the normal hygienes, normal distancings, normal. When you get infected, don't go out into the crowded places and infect others, because the infectious variant, these variants are very infectious. They will jump from one person to other person very fast. So if you are having a fever, you are having a sore throat, you have a running nose, uh, so these symptoms are mostly like any other upper respiratory tract infection. So might be this is a COVID. We are not testing that. The cases are so low because the testing is not high. Once we start testing everybody, then you will see the cases will be jumping like anything. So no need for testing, no need for panicking also. Just when you are having that, you take the normal medications, normal flu medication, take a paracetamol, take lots of fluids, and stay home for a day or two, or at least 3 days. So that would be helpful. And maintain your hygiene. You put up the mask when you're going outside, and that's it. Nothing to be panicky about.
Great, sir. Great. Thank you so much, Dr. Bardhan, for your time and your valuable insights. It's been really and incredibly helpful to hear your expert perspective.
Thank you, Yaksha. Thank you for coming in here.